And here with answers to your medical questions in our Ask the Doc segment is Dr. Msonthi Levine. So the more you kiss, then the more you can eat after each other and drink after each other, and it's not a problem.
Yeah, I don't think there's any danger. Obviously, it's a nice little experiment, but we can't get rid of the microbial world that we live in. Viruses, bacteria, fungus, parasites. They're here to stay. We have to learn how to live with them. So I don't want people to get paranoid looking at this particular study. Some of that, it makes common sense. If you share a certain environment with a loved one, you probably will pick up the same sorts of illnesses and bacteria.
Whether you kiss or not.
Whether you kiss or not, absolutely. So we certainly don't want to lose a romance in relationships, because a healthy relationship revolves around healthy romance. So continue to kiss. And don't be afraid. And certainly if you feel like you're coming down with something, certainly go to your primary care doctor, healthcare professional, and get treated.
And you may as well pick up 2 prescriptions as opposed to 1, because more than likely...
Yeah, again, these sorts of studies just kind of make us a little bit more paranoid about living. And that's the thing I don't like about it, because we cannot get away from that. You see the commercials on TV about antibacterial soaps. You cannot live in a sterile world. It will never happen, so just get used to it.
I think they probably had a lot of people that signed up for this study. What do you think?
Absolutely.
Probably no problem
Have
there.
a little fun in the meantime.
Yeah, exactly.
In the name of science.
We've got a lot of questions, so let's get right to it. This person says, I've had 3 major falls in the last 2.5 years. I'm 61 years old. I'm a woman. My bone density test came back great. I have osteoarthritis. Is there a blood test that can be done to determine why I fall? I don't ever feel dizzy.
Well, yes and no. Certainly just routine blood work such as thyroid, anemia, kidney function, vitamin deficiencies, because that can impact the neurological system, which is one of the systems we look at when people are falling. As we get older, our problems with falling can increase, unfortunately, because of multiple medical problems, medications, neurological deficiencies, neuropathy. We talk about that a lot on this show. So yeah, the blood work can predict and show maybe some problems, but it's not necessarily specific for falling necessarily. A lot of times we will include an MRI of the brain. If you have risk factors for heart disease, we will do a cardiac evaluation, because sometimes heart conditions can cause you to fall. So a lot of different issues can come about as you get older that can increase your risk of falling. So non-specific blood work, certainly going for an evaluation.
Okay, another question. I've had a few surgeries because I have deterioration of the bones, and I've been operated on my neck twice, and I know my right side stays numb half of the time. What is doing that?
Deterioration could mean a couple of different things. It could just mean degenerative joint disease, which we talk about a lot on this show, DJD for short, or it could be osteoporosis, which is a thinning of the bone. Sometimes you can have both. Again, these are issues that come about as you get older, could increase your risk of falling as a result of that. So just get some x-rays, some blood tests to determine if you have one or both. We certainly can treat osteoarthritis with anti-inflammatory medications, and we can treat osteoporosis as well with several medicines we call bisphosphonates, such as Fosamax, Atelvia, just to name a few.
So you can reverse osteo...
To a certain degree,
okay.
Yes, it can be controlled once it's diagnosed. You certainly have to be on the medications. A lot of controversy with those bisphosphonates, with osteonecrosis, teeth falling out, fractures. So just talk with your HCP to determine if you're a candidate for those medications.
All right, we've got lots of other questions. We'll get to those in just a minute, so don't go away. Dr. Levine will answer more of your medical questions next on Live at 5. We're back with Dr. Msonthi Levine to answer more of your medical questions. Here is a 48-year-old female. Why are viruses going around so bad this year? I've had 2 in the past month. Is it... Oh, I love this. Greg Bostwick is going to love it too. Is it the weather?
It could be. We see a spike in viruses during this time of year. Actually, the science behind it is a little foggy. We're not quite sure why we see that spike. It hasn't been that terrible based on my experience. Last year was really bad.
Yeah.
We're still in the middle of it, so it still could get worse. Hopefully the message is getting out to get your vaccines, because that prevents spread. Herd immunity is what we call that. So hopefully more patients are getting their vaccines, and it's kind of cutting down. Unfortunately for this particular person, she's had 2 infections, which you can have.
Yeah.
It's kind of rare. We don't see it that often. Certainly the more medical problems you have, the more likely that is to happen, especially if you live in a place where there are a lot of people, maybe at work. It's being shared around, so it can possibly happen but it hasn't been too bad in my experience.
Okay, a 49-year-old female. If you've had a hysterectomy, do you need to take estrogen?
Not necessarily. Certainly, we recommend that if you are having symptoms related to estrogen deficiency. For some ladies, that's hot flashes, mood swings, insomnia, just generalized fatigue. I just don't feel very well. I'm not myself. So a lot of times we will have a discussion about hormone replacement therapy. Certainly if it was for cancerous purposes, probably not in this person's best interest, or if they had issues of DVT or blood clots, not in this person's best interest. So a lot of times we leave it up to the patient, but if there are some contraindications, we normally do not recommend it.
Okay. A 72-year-old female, is there any way to treat a bladder infection without antibiotics?
You know, in my experience, a lot of ladies will do that and get away with not receiving any antibiotics. I think azo is a popular medication over the counter. Cranberry juice, the actual juice, or tablets work pretty well for mild infections. I think it can be used, certainly if the symptoms don't go away, get with your HCP for some antibiotics.
Okay, a 62-year-old female is having severe leg pain. She's had an MRI and an X-ray, but she's got no answers. Could it be a blood clot?
I mean, I think it's good that she's gotten a proper evaluation. You know, we cannot diagnose every single pain that a person has. Could it be blood clots? Probably not. Blood clots will cause swelling to worsen every single day. It'll get bigger and bigger and bigger, more painful, maybe even associated with some chest pain, because if it is a blood clot, it can go to your lung and cause a blood clot in your lung. That will cause chest pain, shortness of breath, low oxygen level. So it doesn't sound like a blood clot. It could be poor circulation, which is different from a blood clot typically, and normally you can do an ultrasound of the arterial system to figure that out. So keep following with the HCP. Sometimes it takes a while to figure out these issues, not the first or second time, maybe the fifth time. So don't give up.
All right, thanks, Dr. Levine.
Yes, ma'am.
Unfortunately, we're out of time, but you can always visit our website and see the answers to these and other medical questions posted online. And if you'd like to have Dr. Levine answer your medical question, you can always mail us at the address listed on your screen. Fax us 892-7305. Email us at laf@kfdm.com or post those questions every Monday on our KFDM News Facebook page.